Okay, everybody, if you can come back in, please. I'm going to call on tables in a reasonably random fashion to feedback. Can I get everybody's attention, please? Okay, I'm going to call on tables, and again, it's literally 1 minute. We've had, I think, more time to have at least an engaged deliberation at each table throughout these sessions. What I'm going to do now, each call on 3 tables again, 1 minute each, please, because we've 15 tables we need to get through, and it's just simply, please do feedback from us. You know, any key priority that jumps out to you at your tables over the course of this weekend that we need to put focus on. So I'm going to call in a random fashion. I'll call 3 tables in advance. So tables 5, 10 and 15, please. So table 5, please. And again, literally 1 minute, please, if we can. Table 5.
Now, so over the weekend we had a few points there. So the first one would be education, educational programs in schools. Kids need to be educated more on drugs in general, and be made aware of the harms. But not only that as well, the parents need to be educated as well, like to spot the signs. If kids or the parents know that they suspect something, they could probably have a better grasp of it and know what to do at that stage. As well as that, in schools there should be a permanent role, like a staff member, someone who is a health professional, a psychologist, spot the signs, you know, instead of that person having to go through that school or go through a couple of months without getting any help. The school could intervene, help out, and again, the parents could be also involved there. General investment in services across the country. More facilities, we can accommodate more people, especially professionals. We need more trained people in these facilities that can cope and that can tackle these issues that are happening.
Okay.
Just one last point, GPs services there in the country. If a GP is to refuse or not to take anybody on who's a drug addict or is seeking help, a letter of refusal should be issued to that person.
I'm sorry to cut you there. It's always great when you ask people for one thing and they give you really rich a few more. So no, listen, thanks, and it's really good feedback. Just on the issue of education, you've positioned very well a session that we will be having in September around prevention and education. But look, thank you very much. So table 10.
Right, I'm going to less than a minute. We have 2 recommendations about drug policies and practice must be above party politics and accountable to an independent oversight body. That's one. And the second will be the different department responsible for social capital offering will have targets that allow an oversight body to hold them accountable for health-related outcome.
Thank you very much, and 2 very strong points I think that did come through at the weekend, oversight, and I'm glad you picked up on the issue of social capital and how diverse that is beyond just health. Thank you. Table 15.
We had a well-funded national approach to coordinate a range of services accessible locally, and a big one for us was implementing existing programs and eliminating current barriers. For example, the diversion program, which has been developed 4 years ago and not implemented due to legislation.
And thank you again. Thanks for being prompt. And again, I think something that did come through was the issue about national and the power of local. And there are a lot of existing policies that need to be put into action. So thanks for that. Okay, can I call on tables 3, 8 and 13, please? Table 3.
So our discussion came to the conclusion of that the biopsychosocial model should be made a part of medical training, so possibly compulsory training for GPs.
Thanks, Hannah. And again, it's a very strong piece that came through from yesterday afternoon, and the power of it and the greater understanding of what it is and what it isn't. So thank you for that. Table 8, please.
We concur with Table 10. about the National Task Force with oversight and being a statutory body. We also would like to mention that the service providers in Ireland, we believe they should all adopt best practices and be incorporated together under the umbrella of the National Drug Task Force. And we believe one of the largest providers of help in Ireland, Cúnmara, haven't been mentioned here today, and we believe that all providers should be aligned and provide the same service as per best practice. And the last thing is, we believe under the task force should be included housing, health, education, employment, social services, and transparency around funding this support, that everybody knows where everybody is at. Thank you very much.
Thank you. And I think that's interesting, because you've gone beyond just oversight. You're saying a task force to implement, etc. And we'll take good comments and note of that. And also the issue of alignment of services and building on best practice and rolling out. Thank you. Really good points. 13, please.
Yeah, most of what we have has been said already. We're looking for an expertise body that would be a steering committee with accountability over the whole process, with horizontal communication between all the bodies. No need to reinvent the wheel as such, because we have the expertise here, and it's just maybe expand and roll out these across the whole of society. Educate the GPs, a national destigmatization campaign, and the community in-place treatment and in-house treatment, and obviously a health-centred approach, and use all the schemes that we have. For example, there's CE schemes that work, and just expand these for people. Basically.
Really good point. And it's, often we think we have to come up with new ideas. I think what I'm coming through strongly from tables is scaling up some of what's in place and building up again. And again, the oversight that you've made a very strong point on again. Table 13. Oh, sorry, I've gone to 13, have I? Apologies. So 2, 7 and 12, please.
Excuse me. I think everything that has been said is sort of, we sort of agree with that there here as well. So the holistic approach from Dr. Joanna Ivers, the recovery capital, yesterday Dr. Foy with the biopsychosocial implementations, government accountability and transparency would be great. Thank you.
Thank you very much. And again, it's good to see a level of reinforcement coming from the tables, accountability, oversight, again, coming through strong, and the models of care. Table 7.
Just from table 7, again, like what everybody has been talking about, is the stigma side of things as well. And there has to be an overall approach on that stigma. It's horrific to hear about doctors as well, and basically doctors refusing these people and not training themselves in it for something. I think the doctor said a half an hour it takes for methadone to be learned. The other big one from our side was we would like to see about accountability already, about how much money is currently being spent on the mental health service. I know we spoke about it previously, but again, with all these splinter groups and with all these different organisations, maybe a suggestion would be to bring someone like the HSE in here and the chairman of the HSE, and basically be accountable for how much money is being spent on it, how much money is being spent on charities, because there's wonderful, these people are incredible people doing their job, but they shouldn't have to do that. It's, for God's sake, it's crazy to think that this isn't being done under the HSE. Sorry, Paul.
Not at all. Thank you very much. Don't apologise to me. Not at all, and thanks again. And look, I think the whole issue of the spend and the alignment of services at mental health, is it a spend on drugs, is a key issue that we'll have to come back to again, and the best use of government funds and priorities and accountability. So, well made. Table 12.
Yeah, we have a lot of the same points about GP training, and there's a destigmatisation campaign currently running in Scotland, which might be similar campaign could be run here, might have an immediate impact. We were also looking at the methadone clinic overhaul, where what Nicola said, where she didn't have any care plans. So maybe as soon as someone comes in looking for methadone, that they get an immediate care plan and a caseworker over them, and then that will follow them through their treatment, hopefully, just practically, and obviously an oversight body.
Thanks again, and again, the whole issue of care plans and follow through, excuse me, and stigmatisation, how much it's coming through again in all of our sessions. So thank you for that. Can I go to table 1, 6 and 11, please?
So thank you to everybody who spoke to us today and yesterday. Of course, kind of great information for us, so thank you very much. A lot of talk at this table, and one of the first issues we talked about today was programmes for prisons. We hadn't kind of thought about that before, and that was quite interesting today, that there isn't a service or help in prison. The other thing that came up was the doctor's training. We were all a bit stunned with what Dr. Austin told us about how GPs don't necessarily take kind of drug addicts on board, and they don't see maybe they don't see drug addiction as an illness, and we think that should be emphasised more. Other things, we thought a task force that kind of helped kind of collaborate all the services was vital, and really good funding, I think, is necessary as well. Thank you.
Thank you, Maeve. And again, the whole issue of prisons. Actually, we will come back to criminal justice, but I know your point was particularly on the services within prisons, and we should line up some speakers to talk and give us a better insight into that issue, which we know is a pretty big issue, and the oversight. Okay, table 6.
Yes, we really concur with what everybody else has been saying at their tables, which is a great advantage, for the room, that we're all on the same table. But just one issue that we felt really strongly about is trauma. Trauma is the root of addiction, and this has to be recognised and the stigma removed. And then the other point that we didn't feel came up yet was just to change the whole issue from a judicial issue to a health issue. Thank you.
And thank you. And thanks for raising the issue of trauma again, because we've heard from all sections so far, people who suffer early life trauma may use drugs to get some relief, make it into addiction, and then be criminalised. So it's an awful vicious cycle that happens. Table 11.
Thank you. We'd like to see radical changes in legislation and regulation across the board in order to remove the criminal element from the drug market. The tax revenue could be used to fund addiction support and for prevention strategies. We'd also like to see a high-level spokesperson to promote this approach with a massive public education campaign, and we think all of this will enhance the common good of society.
Thank you, and very well made points. The issues around criminalisation and redirection of resources, I think, is what you came through as well, and the public awareness and public education, very strong points. Table 4, 9 and 14, please.
We're reiterating points other people have made about sort of an interdepartmental approach, except for we like it tomorrow, please. We'd like it done immediately. We think it should be led by the Taoiseach. Under sort of, the point was made that the book has to stop with somebody. So we're talking about something maybe at a sub-cabinet level, and something that goes down through department level all the way down to frontline services. So integration at that sort of level that's resourced and timelined and comes from a social partnership model. So to make the point that I think it was Anna Quigley made, that when it's assessed, we have an independent assessment, but an assessment that's also done with all the stakeholders having an input in the assessment, so when the implementation is looked at, we can be assured of that accountability that other tables have said they'd like to see. And we would also like to see the voluntary and community sector equally resourced. So this staffing issue that they're having where they're losing staff and not able to retain staff because of salaries, staffing benefits, that issue is also dealt with. Okay. And then also, as other tables have said, about methadone use, both in clinics and GPs, that there's an equal focus on stabilisation and recovery from the outset. This is for people that methadone isn't working for. For people it is working for, that's great.
Okay.
But for that section it's not working for. The idea that other people have said about a care plan and an equal focus on recovery and stabilisation.
Thank you. And again, I think the point you make is quite strong about urgency. You know, it doesn't have to wait for an assembly process to complete, but urgency is well made, and the power, I think, and influence and benefit of a voluntary and community sector is quite strong. So, well done. Table 9 and then table 14, please.
Yeah, so we've had similar thoughts as to the other tables, which is really validating and nice. One of is to destigmatise the topic and to decriminalise the person, give them the compassion and dignity that they deserve, and then to educate society in a broad level of things, including GPs, getting them trained up, harm reduction, and maybe have a media campaign with real faces to the data that we see.
Thank you. And again, education, prevention, public awareness, public communications coming through very strong and consistently, thankfully. At table 14, are we to the last table, but not least?
Thank you. We have proposed a model of an oversight committee which would be non-HSE, and it would be called Larry. If you want to know about Larry, ask Adrian. This body would be independent and depoliticised. It would oversee and be responsible for policy, coordination, and implementation. And at every level, there would have to be accountability. An example of such a body in the past was perhaps Bord Fáilte.
Thank you. And again, I know it's come very consistently up about oversight, and we will have time when we come to our recommendations and deciding our recommendations to define what that oversight is, because there's various flavours in the room, so Cabinet Committee or independent oversight or task forces. So we'll have a time to come back to that, but I think a consistent message is coming out about strong oversight. And as a person who's reported into Cabinet Committees regularly throughout my career, they are very powerful. They do get cross-government priorities. But let's come back to that and see what people really feel is the best proposal that we might make in that regard. So look, thank you very much for concluding on that session, and thanks very much for all of your engagement over the weekend. I just want to close with a few very brief closing remarks. First of all, in case I forget, I want to do the usual thanks to people who make all this happen. Not always behind the scenes, but mostly behind the scenes. First of all, to Darren and Lisa, our Irish Sign Languages people. I mean, all of us. We get a chance to draw breath and step in and step out. They don't for the whole weekend, so thank you very much, Darren and Lisa. Secondly, again, to the hotel, thanks very much. We know we felt very hot yesterday, but overall, I have to say, again, they give us a great service in terms of the timing, the efficiency, the quality of the meals. I hope you'll agree. And thanks to Matt and all of his team, the hotel. Indeed to Pi Communications, who look after all of our web broadcasting. It's quite professional if anybody ever has a chance to look in. It's well done, well designed, so thanks to Pi and Jerry and all of his team on sound who make it just seamless, but it works. To all our facilitators at the team, again, working with yourselves, giving a huge commitment, but working really well with us, and I want to thank them for it. And again, thanks to Cathal, Jerome, the team, and all of the team who are here. Not just who are here and the work they put in over the weekend, but I can vouch for them, after today, tomorrow's work, we'll be planning for the next session again. They're looking at me funny, but yes, it will. No, the preparation, the work they do in terms of planning and preparation and engaging with stakeholders. One of the hardest challenges they always face is, there could be a line of 200 people really want to come in here and present. And it's a difficult challenge to try to get the mix right and get people in who have a good spread and a good value. But look, thanks to the Secretariat, they do phenomenal work. And again, just to state all of the presenters who presented over this weekend, again, what I'm really impressed at, people really want to be part of this process, and every presenter who's been in here over the weekend, we try find kind of different models for different people. Some people are happy to come up to a podium and present in PowerPoint. Some people are not happy to come up to a podium and present in PowerPoint, and are more happy to have a facilitated discussion. So we have to allow that, and we have to understand that. So we try to find a mix, not just that suits ourselves as an assembly, but suits the individual contributors. But all of the contributors have all come up to me individually after every session, and just feel they're feeling privileged to be part of this process. I know we are, but they're equally feeling very privileged to be part of it, and they're very enthused, and they're very interested and very engaged about how our deliberations might go. So thanks to all of the contributors over the weekend. So look, finally for myself, just a few closing comments, take away from myself. As we said at the start of yesterday morning, we were going to focus on policy and services, and we will have a detailed discussion in September now around the whole issue of criminal justice, legislation, criminalisation, all of that complex agenda, and we are working on that already. But we did give I think we did justice, you did justice to discussions and the deliberation on the policy issues and the service issues, so well done on that. If you take away messages from some of the presenters, I think there's one thing I took away from yesterday and today was, probably reflects about Ireland, the power of community and the power of local. You know, so while we talk about national services and the need for national services and national oversight, there's something about the power of local and the power of community, and how we get those services integrated from a national funding model and a national service delivery model. But I think we're at our best as a society in community and local, and that's where it works best. So there's something coming through strong about the design of services and the funding of services and the coordination and alignment of services. The other issue I just wanted to take away was the reasonable discussions around the barriers to entry into services. You know, so it's one thing, and we heard some good success rates from all of the service providers, but we equally heard barriers to entry, and some of it can be just communications. There was really good discussion yesterday about making it clearer. But there are barriers to entry, and that again can hurt marginalised and stigmatised communities much more than others. So I think we'll have to consider a later stage, and Johanna's been very good at this as well with us, just what are the barriers to get people into services and into recovery, and that's something we'll come back to. Just in terms of kind of next phase, what I will ask you with your individual contributions, but also through the steering group members, again, we put the names there. We're going to bring the steering group members together in a room within the next week, 10 days or so. So please do feel free to feedback through our facilitators how we might design each session, and you're going to give us some evaluation forms. That's really important for us. But again, I say we're trying to find the mix. Some people do their learning through PowerPoint. They like the evidence. Some people like data. Some people like the human stories. We all do our learning differently. So we're trying to find a mix here between panel discussions, facilitated discussions, PowerPoint and human stories. So bear with us. We all do our thinking differently. Some people have different preferences. But do feedback through your steering group members, what we can do differently. We're always open to it. We've tried many different things. And I heard a bit of feedback throughout yesterday at dinner. Some people feel the questions, the 5 minutes or so around the table to develop questions and then open, could be reversed out and give more time first and then ask the questions. So again, we flipped that before, we'll flip it again, whatever works best, just to say that. Look, in closing from me, I know I do want to call on Cathal just after we formally close, but in closing from myself, a few takeaway messages overall from where we're at the minute. I think there was a really strong point made yesterday and today. Sometimes history repeats itself, and you could hear from the service delivery people yesterday and today. You know, people were talking about the Pat Rabbitt report or 1996 and the campaign against drugs, and we seem like we're back there again. And some people were asking a really good question yesterday: why are we back to, nearly where we were starting from? And I think that's a really important thing for us to internalise, because whatever our recommendations come, we need to be thinking about execution and implementation. So very strong piece coming through there. I think the equal strong piece that came through in the last 48 hours was the evidence from the Health Research Board. We've heard lots of human stories and we understood it, and it was really powerful at the last one. But I think equally powerful is how we can match this with evidence. And the evidence that we heard earlier this week and we heard yesterday for the first time, more people are dying through drugs. A 10% increase last year in the numbers of people dying through drug poisoning, drug overdose, drug-related deaths. That's very impactful. That's a very important figure for society. We are a laggard in Europe in terms of drug-related deaths. I've no doubt that information is going to put us further behind. So that's something that's very powerful, evidence-based, along with the human stories we heard, that needs absolute urgency. One of you said it at the table. And in my view, when the problem is changing and moving away from you rapidly and escalating, you have to change something. You have to change the policy, you have to change the service, or you have to change the legislation. Something has to change for us to catch up on this rapidly urgency situation. And I said it the last time, I said it yesterday, I'll say it today. It's a call to us, it's a great privilege for us now to be in a position to make recommendations, to bring forward to government. We are in this privileged position that we can land that data and land recommendations to make this better. But it's an equally strong call for policymakers, for government ministers, for our Oireachtas, for government overall. This needs action. This needs to get the top of the priority agenda. We all know the social issues we have with housing, homelessness. This is up there. The evidence is there, it's deteriorating, it's getting worse. We're in a privileged position now to come forward with recommendations, but it needs urgency and it needs rapid attention. And it is, in my view, it's a wake-up call for us to get our act together. We really need to. We really need to. So look, I'm going to close and thank you all for your engagement. And when I did the thanks, the one thing I want to keep for the end is to yourselves. You know, I am nothing but impressed and inspired by the commitment, by the dedication, by your engagement, by your deliberate, by your professionalism to all the discussions that's going on in the room. So thanks very much. You deserve a round of applause. Well done.